My name is Laurence Ruel. I'm project manager at Psychoactive Substance Public Health Association of Quebec. Marianne's going to talk a bit more about our organization, but I'm happy to be here today. I will facilitate the Q&A at the end, and as Tina said, please do write your questions in the chat as we go, and we can answer at the end of the presentation. Hello, everybody. I'm very happy to be here today. My name is Marianne Dessureault. I'm a lawyer, legal affairs attorney, and spokesperson for the Public Health Association of Quebec. I am the one who prepared, reviewed the content of the consultation report and also led the consultation. I've been with the ASPQ since 2018, first as a project manager in psychoactive substances, alcohol and cannabis particularly, and I'm very happy to be able to talk about this consultation today with you. It happened in 2023. I also want to say, and it's important to say, that I'm a municipal councillor in Saint-Donat in Quebec since 2021. So the ASPQ is a non-for-profit that unites about 1,000 partners, citizens, and organizations, and its mission is to make sustainable health a priority. Mainly through prevention. We discuss many subjects. We have many priorities, and the psychoactive substances is one of them, alcohol. And the objectives are there to reposition alcohol as a public health priority in Quebec and in Canada, I'll say it as well, by counteracting the normalization of alcohol and advocating for responsible alcohol regulation. So I think that the greatest question is why focus on alcohol at the municipal level? Mostly is because alcohol is a substance that is well accepted socially and culturally, and we see it everywhere. We have examples. You probably think about a few examples, advertisements, points of sale, products as well. And in Quebec, alcohol consumption is higher than the Canadian average. So that's why we are interested in on that topic. It's not a substance that is normalized, and it has effects on health, safety, and often social cohesion in the municipalities. In Quebec, we talk of social and healthcare costs close to $3 billion per year. Why municipalities are interested in this is because it can play a key role in prevention through actions. The WHO report in 2010 highlighted the importance of municipal alcohol policies. So it's in this context that the ASPQ started being interested in this and started questioning municipalities. In Quebec, municipalities, as in other provinces in Canada, they are proximity governments. So it's the decision authority that is in direct contact with the population, that witnesses many of the challenges in terms of security, social cohesion, but also healthcare. So the municipalities can address these well-being issues and help their population. laws in Quebec recognize these authorities and direct action on the environment, public spaces, security, and also land use planning. I put examples here. For example, there are Quebec law here in the presentation that touch on those authorities. I also want to say that other Canadian provinces have more powers in terms of healthcare, namely in public healthcare. Sometimes with a regional direction of healthcare, municipalities have a greater say. When we talk about municipal powers, as I said, the healthcare aspect is not the angle that is first top of mind for actors. So that's why it's often a field that is not something we think about. In fact, more than 50% of organizations that respond to our survey said that they didn't have the resource or the tools to address alcohol-related challenges. Just a few municipalities had included that into their regulation corpus. So these competencies are not well known, but they exist, and municipalities can then act. And that's what we're going to talk about in this presentation, how the issues of alcohol can be incorporated in the regulation frame. So the consultation had as objectives to understand the issues experienced by municipalities, identify the needs of the municipalities, and also to document the practices, good examples as well already in place or existing, and then to propose potential actions. To do so, we sent a survey in French with about 20 questions to 1,261 organizations that are, we talk municipalities, cities, MRCs, CMMM, and boroughs. So regional municipalities, so in smaller regions as well. So we sent that by email from June to August 2023, and we received 135 responses, and amongst them we covered 16 regions, municipal regions, and 5 of Quebec's largest cities. We also had a few individual interviews with some voluntary organizations. So all of Quebec's regions were covered by this survey. We missed only one. And these regions, municipalities, represent the Quebec. So they give us a good idea of Quebec. So 71% are in rural settings. 76% of respondents had populations under 10,000. And that represents well the Quebec profile. 5 of 10 largest cities of Quebec also responded. I'm not going to read all the numbers and statistics, but you do have access to that presentation. But globally, the greater majority of respondents in municipalities observe problems related to alcohol in their territories and within their population. And more than 50% feel that they don't have enough tools or training to address them. We will see that most of the issues were related to public nuisance, impaired driving, or consumption during events. What we saw is that we focused on issues that were identified as priorities, and that's what you're going to see here. But it's important to say that this perception of the issues varied with different factors. So the size of the municipalities, the demographic profile, and the presence of university, student populations, and touristic activities. So globally, and that's not surprising, the more the municipality is big, the more issues we see. And also the more we see activities, holiday, people coming over for tourism, and that can also create a perception of issues and nuisance, and also if there are student populations. Inversely, the more the population is getting old, the less the population mention issues related to alcohol. Among the issues that were identified as priorities, and it's not for everybody, the issues identified as priorities, impaired driving is really number one, the youth consumption of alcohol, and nuisances in parks and public spaces, namely the waste issues related to alcohol consumption. So I will talk mainly about these today, but you have the stats here for the other issues that were observed, and you also have the detailed report available on our webpage. The report is in French and in English. So when we talk about impaired driving, it's an issue that 37% of responding organizations have talked about. So it is a priority, considered a priority by 40%. So it's a third of the organizations who would like to have tools for awareness. So when we talk about impaired driving, we ask why. What can a municipality can do? Often we think about the province and the federal, but it's important to remember that these issues create problems within the community, can also relate to damage of public goods, and also, of course, in terms of health and well-being. Why then can a municipality, what can a municipality can do then in this aspect in terms of prevention? I will take the example of Terrebonne, who in 2015 created a prevention campaign around impaired driving. So they saw that there was a problem here in their environment, and this campaign was really led by the municipality on internet, also advertisements, signalization. The city of Quebec also recently, through its prevention strategy on impaired driving and road safety, spoke about speed, about lane planning, and also impaired driving. So it's a novelty, it's an innovation, and I think it's important that municipalities know that they can address this with their population. The last initiative is provincial, called Code Bar, and it involves municipalities and bars and restaurants. So the environment settings that want to participate in this program create with la Société d'assurance automobile du Québec a program for people who will drink in bars to help them choose a designated driver. So this person within the group receive during the evening free alcohol-free drinks so they can drive everybody else who actually drink alcohol back home safely. And it's very popular among students, for example. So a few cities in Quebec participate in this program. Longueuil, Sherbrooke, Gatineau, Laval et Montréal are examples. So it's an initiative that could be reproduced elsewhere in Canada. Youth and students, that's a subject, a theme that is considered a priority by about a third of responding organizations. Particularly in university and college environments, not secondary. They showed interest in this theme, and it's a little bit more delicate because talking about alcohol and the youth and students is a transversal issue. We think of safety, but also about healthcare, hospitalizations, for example, consumption amongst youth, and also consumption is in festive settings. So it's an issue that we need to address with many partners and many collaborations to be able to talk to the youths and cover all aspects. A great example is the policy of the city of Sherbrooke from 2018, and this alcohol and youth strategy comes from the will of a university researcher and the municipality who observed that there were more and more problems related to consumption city population and the community. So they all sat together to try to create an action plan and a prevention plan. After this policy was put in place, many measures were taken in the municipality, but also within the university with the collaboration of students' associations. So it was a great awareness campaign. Many awareness activities were also put in place. Parks and public spaces is a theme, an issue that's very controversial. The regulatory models vary greatly, and sometimes it creates certain people want to have a moment within friends, have a drink in a park or in a public space, but on the other hand, going too far, then it will create nuisances amongst other park goers. So there are many regulatory models in Quebec that were picked up within our consultations. In general, we permit alcohol with a meal, or we designate zones, or there are restrictions based on certain times of the day. Other environments forbid alcohol consumption in parks. So when there is regulation by a municipality, the less they saw problems or issues. It's important to consider that when we choose a regulatory model, there are stigmatization or over-policing or ticketing that can be related to a certain type of model. If we prohibit consumption in a park or in a public space, for example, the people in the homelessness situation could be targeted more than others because they consume or they want to do so in public spaces because they have no other places for that. So there is stigmatization that could be related to that. And this is where we amplify at times issues of social cohesion by prohibiting access and integration of certain individuals. I want to speak of an example here in Val d'Or that hired and created a function, a role within the municipality, a person that was responsible for social development, and the role was to ensure cohesion within the community. So go and ask questions about consumption, homelessness, and try to bridge the two realities, the reality of the people who complain, so the residents, families, and the reality of the people who were consuming, who were part of this environment, so First Nations in this case. So Val d'Or, the objective was to bridge the two realities and integrate and have discussions between different groups, so homelessness people, First Nations, and residents, namely in offering volunteering opportunities and where people could exchange, and it really helped. And people ended up accepting the consummation a little more, and these targeted groups were a little bit more careful about their own consumption. Finally, events, it's another issue that 27% of organizations talked about in the survey, but even then, only 12% consider that it is a priority. The main issue here is waste, from beer cans, bottles, etc. But we also heard about security, safety issue when a lot of alcohol consumption is involved. It's an issue of public order, as I said, and there are some inspiring initiatives. For example, Festif de Baie-Saint-Paul, who created comfort zones where private sponsors, for example, create zones like this during events where people can find a respite and if they have issues for security or so these areas are designated. There are people there who can intervene and offer support to festival goers. Often we don't think about this next issue, but yes, sorry, I forgot what I was going to talk about. It might come back, but comfort zones is something that municipalities can think about, and municipality can also have policies for events and to have also non-alcoholic beverages sold. So in terms of sponsoring as well, maybe restrict sponsorship of alcohol beverages, so to prevent youth from drinking. So nuisance and public order, sometimes permitting issues at the end of the night. 50% of the municipality observe disorder as such, and 85% say that in their territory, people cannot consume alcohol in public spaces. But despite that, there is still nuisance, and it's mostly because of the lack of application of regulations on noise or bylaws on public disorder. Tools that we often forget when we are municipality is that we have a great power in planning and land use management. The majority of the organizations regulate points of sale through zoning. 30% said that they have no specific rules for alcohol points of sale. So when we talk about specific zoning, it's to decide where can a detailer sell bar, grocery stores, or where they can sell alcohol. Most organizations have specific zoning, then 5% established conditional use to, for example, to give a permit to a restaurant. The restaurant needs to satisfy some conditions for noise, publicities, etc. In Wales, in England, they adopted this kind of land use management for point of sales, and it showed benefits for public health, and that kind of model can be reproduced in Quebec and elsewhere in Canada. The quota-based limits is not used very widely, only 2%. So that says that in a zone, in an area, we only have this specific number of bar or alcohol points of sale. We should think about it. For example, if we have a density issue, when there are too many points of sale in an area, sometimes because there are schools, well, this influences consumption habits. So it's important to have access to alcohol, but too much could promote a higher, greater consumption. Interesting initiatives, not necessarily on land use management, but on visual planning. So in Rosemont Petite Patrie, it's a neighborhood of Montreal, put restriction on advertisement, so they cannot have billboard in the neighborhood. So less advertisement for the alcohol, which is very present on these billboards. So the objective is to reduce the visual and light pollution. Finally, the city of New York prohibit alcohol advertisement in public transit because the youth, the minors, can have access to the public transit. Enforcement challenges, and I talked about it, that's often why there are more public disorder in small municipalities, so under 10,000 residents, because they have less tools and capacity for enforcement, even if they have bylaws related to consumption and sale of alcohol. One of the reasons is that most of the municipalities rely solely on the Sûreté du Québec in a smaller region. So only 16% have access to local policing or patrol services. So la Sûreté du Québec cannot apply every single bylaw in each community unless they have complaints, and even then. So that's why it's important to have harmonized MRC level regulations. So all the cities of this area, this region, would adopt a bylaw, a common bylaw on nuisance or public order or on healthy living habits. And then that allows for a better application because these bylaws and details are known by the whole region and all the players involved. So the municipalities want to know more. 77% of the municipalities want to learn more about the issues, the problems related to alcohol, how they can act. Most of the tools that are needed are policy models, case studies, general awareness tools, and resolution templates. Those are the principal tools in need. So the municipalities don't know how to act and don't know what are the impacts amongst their population. So as an organization, I think that we need to inform them of what they can do, also inform them on the issues and problems that can happen within their communities. For example, impaired driving, damage of public properties. It's not only quantified in these municipalities. We need to adopt policy models to give example as well, namely for public space, advertising, event, sponsoring, to offer, for example, drinks without alcohol. It's important to support awareness efforts, to offer documents, and to equip also the municipalities with models that are tailored to their own needs. So if you have tools, it's important to adapt them to the reality of the municipalities. So if you can adapt it for the population, for example, in the light of your own issues, that's what the municipalities said they need. So to conclude, alcohol is a transversal issue, so it's important to work with many partners to address all the issues, often because it's very transversal. That's why we don't talk about it, because we don't know where to start. We need to value the role of municipalities in creating supportive environments, and it's also important to support them with adapted tools. So we are now at the discussion part of this presentation. I will answer in English and in French. And if there are no questions, I would like to know what are the priorities or biggest challenges in your settings and what projects or initiatives already exist in your own community.